Deputy Chief Minister Dr. Ashwath Narayan today launched an air ambulance service at Jakkur in Bengaluru. Helicopter medical emergency services drill being held at Jakkur aerodrome. This is the first of its kind drill of a helicopter engaged in medical services. A helicopter ferrying doctors and paramedics flew from Bengaluru to Mandya to treat critically injured mother and infant. It was a mock drill. The team tried to stabilize the dummy patients so that they can be flown in a chopper. Deputy Chief Minister Ashwath Narayan watched the entire mock drill process live streaming from Mandya. This is come as a welcome move here in Karnataka. An emergency ambulance has been launched, of course, with the help of a private player in the state, along with the government welcoming it. Ashwath Narayan there launching this air ambulance today and welcoming the move, calling this progressive. One must remember this air ambulance, of course, comes at a price, but let's hope this service is extended to even the marginalized if they really do need that kind of medical attention. With the help of the government, anything is possible. Let's take a quick listen. Ashwath Narayan who spoke.
This is one of the factor with regard to the emergencies. This is basically to do with more of emergency, to reach out to the people who can't get the best facility in their vicinity. So to address this concern, this emergency services, this is basically to do with the emergency. And moreover, many things are happening. If you look at the manpower, creation of the manpower, medical colleges, infrastructure, hospital, there is a lot of encouragement. We are looking for how best we can improve the health services. Technology is going to play a very big role. Technology will be the hope.
Let's take a listen. My colleague Amrita spoke with a few of these organizers on ground. Let's hear what they had to say about this newly launched air ambulance.
Air ambulances are still quite rare in India, but there is a firm that is trying to bring this to the forefront, and we have with us the pioneers of the same in India. So let's go ahead and speak to Dr. Shalini, one of the directors. So can you tell us more about what kind of services you will be offering and how it's going to contribute towards the healthcare in India?
So you just now witnessed a live drill which was demonstrated, done 120 kilometers away from Bangalore. These people they responded by the chopper and they resuscitated both the lives and brought them back to Bangalore, which is the tertiary care center, which is the right place for them to be for the further intervention. You just witnessed that how effectively it could be done in a matter of 15-20 minutes. So this service is taking the care from the command center, what we call the base, to the patient side. Like, you know, the patient could be in the in the village, the patient could be on the road, patient could be anywhere. So this team will respond through a chopper. End of the day, chopper is just a vehicle. What is most important is the skill and the equipment that goes on the chopper.
That sounds great, but let us go ahead and speak to Dr. Satish about the feasibility to the common people, like you and me, like how the common people are going to be accessible to this kind of facility.
ICAT would work along with the government so that it could be made very affordable or even free of cost. So that's one aspect. I would like to say it's non-existent in India until now, absolutely non-existent. And even if it did, what it was an ad hoc travel or an ad hoc transport. By ad hoc transport, what I mean is, it was a chopper who was sending a doctor who was not trained in travel in air to the site. So that is how it was a couple of years back when some of the people who could afford could transport. But for the first time in India, this kind of air transport with a dedicated doctor who's trained in that aspect.
All right, let's go over to Dr. Neil over there. Sir, can you tell us how it is in United Kingdom and how India can work towards it?
So it's a very well publicised fact that the death toll on the Indian roads is very high. One death every 3 minutes. What is less well publicised perhaps is the additional fact that for every death on the road, there are probably at least 2 or 3 patients who are suffering long-term life-changing injuries and need care for the rest of their lives. And just to try and understand the impact of that, we just need to think for a minute how something like that, an injury like that, would affect our families. If we want to make inroads into those figures, into those statistics, we need in India to adopt something similar to the systems we have in the Western world, in the UK and the United States, where we have an integrated trauma model all the way from roadside to rehabilitation. And the first step in that is getting the patient to hospital in the best condition possible.
So, Dr. Rakul, can you also tell us some of the obstacles you face while implementing this idea in India?
We face a lot of obstacles. The biggest obstacle was that there was lack of integration between the healthcare, the aviation, and the financial services. So our biggest challenge was integrating this service not just as a standalone, but an extended arm of the emergency department and the intensive care unit, where the services can be provided on site rather than when the patient reaches the hospital. And we know we are living in a vast country, a very big population, but the tertiary level medical facilities are centralized. That is the biggest challenge.
Okay. And my one last question to you, Dr. Rakul. India right now ranks 145th in the global healthcare. So do you think that initiative like this is going to change that ranking anytime soon, and how do you see it in the next 5 years?
So that's a very good question. Thank you. I think we rank quite lowly at this point in time. This is an emergency service. Yes, this will play a small part of the big jigsaw puzzle that we are dealing with in India. And if we put pieces together slowly, I think we are on our way up. I understand that we are behind smaller countries as well, but we are a big country, we have a bigger population. As we put the jigsaw puzzle together, which is being done under the current government, and with new Ayushman Bharat rolling out all across India, there will be more budget into things that are required on the streets, on the road, to get the patients in. So yes, we're quite hopeful in the coming 5 years.
Now those were the pioneers of the air ambulance services here in India, which is going to be free of cost as they say it. This is not the similar ones as the private ones that we have, which people have to shell out a lot of money to get these services for. So it is only hopeful that in the future, in the next coming years, that the common man is also able to access this kind of a better state-of-the-art healthcare. With camera person Girish, this is Amrita for News 9 Bengaluru.